The Common Health Coalition is committed to changing the future of health with a simple yet uncommon approach. What would happen if public health organizations and healthcare systems all had a seat at the same table?
What I'm most excited to see come from the work of the Common Health Coalition is partnership. People working together, crossing traditional boundaries, and doing so in a way that feels exciting to them.
What if small county health departments could regularly work with health systems in a business-as-usual way, not just during times of crisis? What if the relationships and partnerships between organizations were formalized and protected against turnover and changes in management? What if instead of telling organizations how they should improve public health, they could focus on the areas that they're excited about and know it will make an impact on their communities? Could we diminish chronic disease burden, curb the overdose crisis, prevent infant deaths from congenital syphilis, save lives and livelihoods in the next pandemic?
The promise of healthcare and public health coming together in an action-focused way, for me, is the promise of an American health system that works.
Clinicians, healthcare leaders, community health workers, and public health professionals alike want to create a more efficient and effective health system. We all want to save lives and improve health outcomes. But even though we share a goal, we don't always work together to achieve it. We've seen what happens when we do work together, particularly during times of crisis.
We share data seamlessly back and forth so that we're able to identify emerging epidemics. We collaborate to make sure that our patients and our communities have access to the services that help to keep them healthy. And we advocate together for the emergency preparedness, the policies, the community collaboration that is core to not just physical, but also social, emotional, and economic well-being.
During the pandemic, we all came together, and as a result of that collaboration, millions of people got vaccinated.
The silver lining of the last couple years is that we really found out where we're good and where we need to get better.
We can't let the momentum fade because these partnerships have the power to address diabetes, asthma, overdoses, and all the other crises we see every day. We all know that the next acute public health emergency isn't a matter of if, it's the question of when and will we be prepared. The Common Health Coalition is elevating success at all levels so that lessons learned turn into lessons mobilized. We don't just talk the talk. Our members are committed to action across 4 key areas: coordination between healthcare and public health, always-on emergency preparedness, real-time disease detection, and exchange of data in a way that is swift, consistent, and actionable to drive equity. We are rolling up our sleeves so that better health for everyone becomes our new normal. We've saved you a seat at the table. Join the coalition today as we work together to improve our health system through better partnership.